You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest today is from Queensland, from the Leukaemia Foundation of Queensland, Kathryn Huntley, the Support Services Coordinator. Hello, Kathryn, and welcome to Health Professional Radio.
Thank you, and thank you for having me.
Our pleasure. Now, Kathryn, I guess I can assume, given the name, that your footprint is Queensland, Australia. Do you go outside that at all, or is that the tight constraints of your organisation?
No, the Leukaemia Foundation has support service coordinators based throughout every state and territory in Australia as well, with similar services in those areas. Sometimes just a little bit of difference depending on how sort of the blood cancers are treated. So in Queensland, obviously, we're quite centralised in places like Brisbane and in Townsville, so we have a big focus on accommodation. Whereas down in Victoria, they're sort of spread out, so, transport's a big part of what they do as well.
So there's an Australian-wide footprint. Do tell us, what is it that the Leukaemia Foundation does? Give us an insight into the organisation.
So the Leukaemia Foundation sort of started because patients felt like there was more that they could have had for them to make a difference to their journey, for want of a better word. So the fundraising started to sort of make changes and build accommodation and be able to do things that make a difference in the grand scheme of things. We put money into research, but at the moment, how can we impact on people who are having treatment or are facing the diagnosis and their families, and reducing that impact, whether it be emotional support. We're all health professionals, so there might be some helping patients with their advocacy in their treatment. It's also looking at sort of outside the bubble of treatment, what we can do to make, as I say, that journey that little bit smoother. So practical assistance with transport and accommodation, financial assistance. So we do sort of household bill cover while people get things, helping them access Centrelink and sort of disability insurance and that sort of thing that they, may never known that they had.
It sounds like it's a very broad scope of patient support.
It is, and quite often when I meet patients, I sort of say what we can do for you as an organisation is actually defined by the individual. So we're in a unique position where we can think outside the box in how and what our support looks like, because, every person walks a different path. So, and nobody plans for these things. So that's sort of what we're about. Even those with, high-paying jobs and that don't. When that income gets taken away, they're in just a dire need as those that don't have any sort of income support and that sort of thing. So we're sort of open to everybody with a blood cancer, and what our support looks like is dependent of where they're at and what matters most to them.
Now, how do people get to you? Are they referred formally through the health system, or can they self-refer?
So yes to both. So our referrals do come through sort of health professionals that we have sort of, spent our time with and are aware of our services. We also get people who will, through Google and those sort of things, find out about us and call our 1-800 number, and that will take them to each state relevant office. And then we also have, a lot of the times we'll get people who've already had contact with our services that will then refer other people within the hospital. So, there's patient-to-patient referrals that come because, people feel that we have made a difference and want, those in the same position to experience it as well.
Now, Kathryn, you mentioned the 1-800 number. Just to make sure we get it in the transcript and it's available to people on our website, what is that number?
So 1-800-620-420, and as I said, that's all throughout Australia, and they'll be directed to each relevant state office depending on where they're calling from.
Now, I can just imagine people scrambling for their pencils now, so I'll say it again. It was 1-800-620-420, and if you've missed it that time as well, it'll be in the transcript on the Health Professional Radio website if you are looking for it. So people, Kathryn, can self-refer to that and be redirected through that number. Do you do a lot of work with clinicians to connect them into your services?
Yeah, so we're obviously health professionals ourselves, so we attend sort of professional development as well as sort of conferences and that sort of thing that gives us an opportunity to meet with patients. And I've had colleagues just recently in Queensland, we have the new children's hospital, so sort of re-establishing ourselves up there with the amalgamation of the two children's hospitals we had in Brisbane. So, time is spent sort of linking in with those people and identifying the key people who are in the best position to identify those who would benefit from our services.
You're listening to Health Professional Radio, and if you've just joined us, I'm in conversation with Kathryn Huntley, the Support Services Coordinator for the Leukaemia Foundation of Queensland. We've been chatting about the services that are offered and the way that people can connect with it. If there was one misconception about the organisation with patients or with clinicians that keeps you awake at night and drives you nuts, what would that be, Kathryn?
I'm going to cheat, and I'm actually going to give two. And the first one would be that because we are historically known as the Leukaemia Foundation, there's a misconception that we only support patients with the various types of leukemias, but we do cover all the blood cancers, including the lymphoma, myeloma, MDS, MPN and other related blood disorders. And I guess another concern that we have about our misconception is because we have the accommodation facilities and we do get referrals for patients for accommodation, that we are actually available to all patients, whether they live in metropolitan areas or, have to travel to come to treatment, that our service is available to all those diagnosed and their families and loved ones with those blood cancers.
You must spend a lot of time awake at night with two of the misconceptions like that. They sound like pretty serious issues. So the historical name does tend to distract people from lymphomas and myelomas.
Yeah, and I guess that's a part of why we spend time sort of making sure that we are trying to get that out both through, networking with the health clinicians and professionals as well as sort of hoping that we get that brand awareness out to the public arena.
Yeah, it's an endless process of education, and I have to confess that one of my big misconceptions was that if you worked in health, you knew all about health. But in fact, so many people are quite compartmentalised and don't have that around. So we hope some of our audience take that message on today. Kathryn, it's been lovely having a chat with you. We hope that having a word with Health Professional Radio connects you with some of those clinicians and maybe clears up some of those misconceptions. Is there a website people can go to get more information?
Yep, we have in Queensland a website, www.leukaemiaqld.org.au, and those listening outside Queensland can also go to www.leukaemia.org.au.
And professionals can, on the website, find connection points there to link into the organisation and better understand the services that are available for their patients and their patients' families who need support.
Definitely.
You've been listening to Health Professional Radio. My guest today has been Kathryn Huntley, Support Services Coordinator of the Leukaemia Foundation of Queensland. A transcript of this interview and a sound archive are both available at www.hpr.fm. This has been Wayne Buckler on Health Professional Radio.